privacy was only visual, curtains used to mask events, but not to hide the spoken word.
Elderly patients were treated and spoken about as bay and bed numbers.
They treated me as a person and not just as a patient.
The loss of a nurse's station in the open ward means less general realisation of patients' needs.
Hello, I'm Ruth Marks, the Older People's Commissioner for Wales. During early 2010, following consultation with a wide range of older people and organisations, I chose to use my legal powers of review to look at the experiences of older people in hospitals across Wales to see whether they are treated with dignity and respect. I established an expert panel of inquiry to gather evidence and to provide advice as I developed my recommendations. These contributions mean that the voices of older people, their relatives, carers, fellow patients, advocates and staff are strongly represented throughout the review report and have made a real difference to our understanding of what is happening in hospitals in Wales. We found evidence of poor practice, and this needs to stop. Not helping someone to go to the bathroom, ignoring people's privacy, and not listening to patient needs are all simply unacceptable. Some of the evidence we received demonstrated examples of effective leadership and good practice, and I welcome this. However, I was particularly concerned about the low expectations that many older people have for their care. People should expect more and have the right to be treated with dignity and respect, something which is clearly lacking in too many cases. Based on the findings of the panel of inquiry, I have developed 12 recommendations which aim to change the culture of caring for older people in Welsh hospitals and ultimately create the conditions for greater dignity and respect in hospital care. I'm just giving the headlines here, but the report gives details about how these can be achieved and lots of examples of good practice. Empower ward managers to run their wards in a way that enhances dignity and respect. Equip staff to support people with dementia. Prioritise continence care. Ensure consultations between patients and clinical staff are held in private. Health and social services should reduce the level of delayed discharges and manage care more effectively together when older people are discharged from hospital. Use volunteers imaginatively. Develop a tool to determine staffing levels on wards are adequate to provide dignified care. Work with patients and staff to ensure new or redesigned wards are beneficial environments. Make sure people know that they have a right to dignified care. Capture and act on patient experiences consistently across Wales. The Welsh Assembly Government should hold health boards and trusts to account when they do not adopt good practice without good reasons. Health professionals should be trained to better understand the needs of older people when in hospital. The publication of the review report and its recommendations is only the beginning. Everyone who has given their time generously to assist with this review rightly anticipates that the recommendations will lead to positive change. Using my legal powers, I have requested that the organisations subject to review recommendations tell me by the 14th of June 2011 how they have complied or propose to comply with the recommendations, or why they have not complied with the recommendations, or why they do not intend to comply. Formal written notices will be issued to any organisations which fail to respond or which provide inadequate information. I will follow up any unsatisfactory responses and, if necessary, will publicise this after following the statutory process set out in the Commissioner for Older People Wales Act. I hope this review will provide support for all those wanting to see positive changes who are striving to deliver quality care in the health service. I will use my statutory power to ensure the recommendations I have made make a difference. I want my review to lead to change in practice, and for that change to be measured through the experiences of patients themselves. I recognise the many strategies, reports and initiatives that aim to make dignity and respect central to care. I trust that my review will add real momentum to these. Fundamental change is needed. Patients need to know what quality care is, and staff need to be supported by systems and resources to empower them to meet patients' expectations. Poor practice should not be tolerated. The attitudes, behaviour and emotional intelligence of staff on the wards are crucial. We need strong, positive leadership at all levels, and a system which builds in dignity and respect as the cornerstone of high quality care.